the U.S. style for-profit healthcare. Repeat again, for-profit healthcare. Our brothers and sisters around the world are closely watching our fight here in the U.S. And our next speaker is one of those who have been carrying on the struggle in her native country. She recently retired after working for the French social security system that is often called the best healthcare system in the world. She was a workplace leader in her union, the Confédération Générale du Travail. I should have had you introduce it. I should have had you introduce it. How do I say Travail? Travail. I won't repeat it again. Well, I'm going to keep going. She's currently active in the CGT retiree organization. We thank the CTG for making it possible for her to address us tonight. So, brothers and sisters, let me introduce not just her, but also her translator, Alan Benjamin, who in addition to being a world-class translator, is also a delegate to the San Francisco Central Labor Council. Paul, you've had your 10 seconds of fame, and that will come out of your speech for tomorrow.
He's on our executive board.
Please welcome our speaker, Comrade Nicole Bernard.
Dear friends, I beg you to forgive me for my very, very poor English. I'm very proud to be there.
Is that poor?
And to express my complete support to your fight for single payer. I've brought the message of the General Secretary of my trade union federation, CGT. You will hear it in English, thanks to Alan, and then I speak to you.
For the purpose of time, I'm just going to read the statement in English, and then following that, Sister Bernard will have her comments. The National Federation of Social Security and Healthcare Workers of the General Confederation of Labor of France, CGT, sends its fraternal greetings to your labor campaign for single-payer conference. It is an honor for our Federation to be able to assure you of our complete solidarity with your struggle for a public single-payer healthcare system. We are deeply aware of the importance for trade unionists the world over of the American trade unionists' commitment to the struggle for collective rights against the profit motive of the insurance companies. Our Federation regroups CGT trade unionists working in all the Social Security and national healthcare organizations. Our Federation seeks to defend and protect all the workers involved in the collective social protection system. This endeavor is obviously inseparable from the fight to defend all the social rights that have enabled French workers, and on that basis the general population, to enjoy a social protection that does not depend on individuals' income. This is why our Federation is deeply committed to the founding principles of the French Social Security / National Healthcare System, known as Sécu, that was established in 1945, a system born in the midst of the great upheavals that followed a very deadly and destructive war. There was a pressing need for the millions of workers who fought Nazi barbarism to fight for and win a healthcare system based on social justice. The 1945 ordinances set up the foundation of a social protection system that can be summed up in the phrase, everyone pays according to his or her ability and receives according to his or her needs. preservation of this principle a cornerstone of its action among workers and within the broader CGT Confederation. The 1945 ordinances laid the foundation for a universal, compulsory, solidarity-based social protection system based on the following commitments. Solidarity between the healthy and the sick, the retired and the active workers. This is encapsulated in the way the system is funded. The French Social Security healthcare system is financed by pooling a portion of wages, thus guaranteeing everyone's healthcare rights from cradle to grave. As a counterpart of the work performed, social contributions link the Social Security and healthcare system to all the other social conquests. It is our common good that we receive in terms of benefits. Universality, because it protects everyone regardless of whether they can contribute or not. The only criterion must be that there is a need. The French Social Security system finances the entire healthcare system from home care to hospitals and ensures access to healthcare for all. It is totally unacceptable that a patient should not be able to receive all the care he or she needs because his or her personal resources are insufficient. This is why the healthcare system must be compulsory, since employees individually do not have the means to voluntarily allocate a portion of their scarce resources to social protection. This system must be public because it is contradictory to profit making. This is the whole difference with insurance. The public single-payer healthcare system that you are fighting for in the United States is the one we set up in France in 1945 and that we are fighting tooth and nail to preserve. Since 1945, the French employers have been fighting against the existence of the French Social Security system. They have claimed since the very beginning that the French Social Security healthcare system increases the cost of labor and is responsible for unemployment. However, over the past 22 years, the different French governments have been reducing the amount of the employer's social contributions to the system, and unemployment, far from diminishing, has in fact increased. The bosses have never accepted that insurance companies had to give up what they considered a very lucrative market. You in the US, where the private insurance companies are making profits hand over fist, know better than anyone else what the French insurance industry lost out with the creation of the French Social Security healthcare system. Here's some information that can be of use to you. The administrative costs of managing the French Social Security healthcare system are less than 3% of the benefits paid out and of total expenditures, whereas the administrative costs of insurance companies in the US, we understand, hovers between 20 and 25%. We cannot in this statement describe all the attacks that have been raining down on our Social Security healthcare system in the recent period. Here are some, all pointing in the same overall direction. Reduction of employers' contributions and drive to fund the Social Security system through taxes instead, with the aim of reducing the cost of labor and reducing overall expenses. Reduction of the share of the public system in terms of reimbursements, thus increasing patients' out-of-pocket payments and leading to a two-tier system in which the public single-payer system is reduced to providing minimum health care coverage. There's a return to a two-tier healthcare system. In such a system, the non-profit mutual insurance companies that were built by the French working class in the 19th century are compelled to align themselves increasingly on the private insurance companies, thus losing all sense of solidarity. Plainly, at the moment when your conference is discussing which course of action must be taken to win a mandatory public single-payer healthcare system in the United States, the French government, although claiming to be socialist, is following faithfully in the footsteps of its predecessors and has set out to meet employers' demands by, quote, Americanizing our system, which means increasing the role of the insurance companies at the expense of the public system. Thus, 1.5 months ago, workers in charge of family and child benefits massively went out on strike to demand a stop to workforce cutbacks. Our CGT Federation of Social Security and Healthcare Workers knows that the French working class and the French people are deeply attached to the 1945 Social Security system. This was made clear by the huge 1968, 1995, and 2010 fightbacks. This is why we have confidence in trade union action. We believe that your struggle and our struggles converge. These are struggles for human needs against profit. These are struggles for life and against poverty and the fear of tomorrow. We wish your conference full success, and we are proud to send our fraternal greetings. We propose to continue and deepen the exchanges between our organizations. In solidarity, Denis Lalisse, General Secretary, Fédération Nationale des Personnels des Organismes Sociaux, CGT.
Je voudrais ajouter quelques mots à la déclaration de mon camarade. Sachez que les syndicalistes européens sont très mal informés de ce qui se passe dans le mouvement ouvrier américain. Mais nous avons su que la 26e Convention nationale de la FLCIO avait voté en septembre 2009 pour un système de sécurité sociale à caisse unique. C'est pour nous un vote historique. Un espoir immense a été créé, il ne faut pas qu'il soit déçu.
I would like to add a few words to Denis Lalisse's statement. European trade unions are very poorly informed about what is happening in the American labor movement. Having said this, we heard that the 26th National Convention of the AFL-CIO was voted in September 2009 to call for a single-payer healthcare system. For us, this was a historic vote. A door was opened, a door that cannot be closed.
Pour les salariés américains comme pour les salariés du monde entier, l'accès aux soins ne doit pas dépendre des possibilités de l'individu, mais correspondre à un droit collectif. Voilà ce qu'a démontré le vote historique de la FLCIO. Il démontre que la situation catastrophique des Américains au regard du droit à la santé n'est pas le résultat de la culture américaine, mais le produit du combat meurtrier du capitalisme le plus puissant du monde contre le mouvement ouvrier.
For American workers, as for workers around the world, access to health care should not depend on an individual's income. It must be a collective right. That's why the AFL-CIO convention vote is so historic. It shows that the catastrophic situation of the healthcare system in the United States is not the product of any so-called American culture, but rather it is a result of the relentless attacks waged by the bosses in the world's most powerful capitalist country against the labor movement.
Au moment où dans tous les pays, les salariés et leurs syndicats sont exhortés à abandonner leurs revendications au nom de la réduction des déficits publics et d'une dette dont les travailleurs ne sont aucunement responsables, votre conférence affirme qu'il n'y a aucune issue pour les États-Unis, comme pour tous les pays du monde, dans l'abandon des revendications vitales portées par le mouvement ouvrier. Le combat pour le single payer prend une acuité encore plus forte qu'en 2009, car il est le moyen le plus sûr de défendre Medicare et Medicaid contre le pillage qui s'organise.
At a moment when in all countries workers and their trade unions are being urged to drop raising their specific demands in the name of reducing public deficits or paying down the debt for which workers bear no responsibility, your conference clearly affirms that abandoning the labor movement's most vital demands is not a way out for working people in the United States or in any country of the world. The fight for a single-payer system is even more important today than in 2009 because it is the surest way to defend Medicare and Medicaid against the attacks currently prepared in the name of reducing the nation's debt ceiling.
La sécurité sociale française, qui est un système à caisse unique, est une création jeune, puisqu'elle date de 1945. Il a fallu des décennies de lutte, il a fallu des sacrifices terribles pour que nos pères imposent ce système. Je ne reviens pas sur ce qu'en a expliqué mon camarade Denis Lalisse.
The French social security system, a single-payer system, is a very young institution dating back only to 1945. It took decades of struggle and terrible sacrifices for our forebears to win this system. I will not repeat what Brother Lalisse has explained.
Ce qui est important, c'est que dans la situation terrible dans laquelle se trouve aujourd'hui la classe ouvrière dans notre pays comme dans tous les pays, le système de sécurité sociale acquis en 1945 reste un rempart essentiel contre la politique assassine de l'Union européenne, relayée par les gouvernements de tous les pays. Alors que le chômage atteint des records, le système de 1945 permet encore d'aller à l'hôpital quand on est malade sans avoir à payer d'abord. Alors que le niveau de vie s'effondre comme résultat des taxes diverses, de l'augmentation des impôts, une personne atteinte d'un cancer, d'une maladie cardiovasculaire est encore prise en charge à presque 100%. Pourquoi presque 100%? Parce que le précédent gouvernement avait instauré une franchise sur les actes médicaux et les boîtes de médicaments que le gouvernement socialiste n'a pas supprimé.
What is important is that in the terrible situation in which the working class finds itself in France, as in all other countries, the social security system wrested in 1945 remains an essential bulwark against the murderous policy of the European Union relayed by the governments of all the EU countries. While unemployment is reaching record levels, the 1945 system still lets someone go to the hospital when he or she is sick without having to pay first. While the standard of living is collapsing as a result of various new and higher taxes, the cost of treatment for a person with a cancer condition or a cardiovascular disease is still covered at almost 100%. Why almost 100%? Because the previous government introduced a compulsory copay on medical procedures and medication, the compulsory copay that the socialist government today has not removed.
Malgré ces coûts, notre système reste un acquis considérable. Alors que toute la population française veut garder le système de sécurité sociale, le gouvernement veut réintroduire les assurances privées qui en ont été exclues depuis 1945. Comment? En rendant obligatoire l'adhésion à une assurance complémentaire. Ainsi, le processus serait le suivant. Diminution brutale des remboursements du régime obligatoire, nécessité pour faire face aux dépenses de souscrire une assurance complémentaire. Et comme la majorité des ouvriers ne peut supporter la charge d'une assurance complémentaire, le gouvernement verserait une aide financière qui bénéficierait au bout du compte aux assurances. Je suis sûr que cela vous dit quelque chose.
In spite of the blows, our system remains a considerable gain. While the entire French population wants to keep the social security system, the government wants to reintroduce in it the private insurance companies that had been excluded since 1945. How? By making it mandatory to enlist in an additional private insurance plan. This would entail a brutal reduction of coverage by the basic universal mandatory regime that would force people to purchase additional insurance plans in order to meet health care costs. And as the majority of workers could not bear the burden of an additional insurance plan, the government would provide financial assistance, ultimately to the private insurance companies. I'm sure this rings a bell with you.
Je voudrais terminer en vous disant, votre combat pour le single payer est un encouragement pour notre combat pour le maintien de notre système de 1945. Je vous informe à ce propos que le personnel de la sécurité sociale sera en grève le 7 février 2013 à l'appel de tous ces syndicats. Considérez notre combat pour défendre le système créé en 1945 comme une aide à votre combat. Restons liés, nous voulons la même chose, in solidarity.
I would like to conclude by saying this. Your fight for a single-payer system is a tremendous encouragement in our own fight to preserve our 1945 Social Security system. I also want to tell you this the Social Security healthcare system workers across France will go out on strike on February 7, 2013 at the call of all the unions in this system, without exception. Consider our fight to defend the system created in 1945 as an aid to your own fight. Let's remain in close touch. We are fighting for the same objectives in solidarity.